Hello. In a previous video, we looked at how to follow up patients who had missed their test, patients that we had no new results for at all. Occasionally, however, you might have a patient who is due for blood count, LFTs, UNEs, and we have some results. We have the full blood count, but we don't have the others. How do we find those patients and what do we do about them? Well, as with all the key workflows in Dawn, we start on the home page with the work list dashboard panel. And this time we're interested in patients with some test results missing. Now I have 3, and if I click through, it takes me to the work list view with the missed tests filter selected. Now I can see I've got the appointment date here, and all these people were due a few days ago, and it's actually saying they're overdue now, which is the point. If they were due tests today and we'd have got the full blood count in, but we hadn't got the UNEs in yet, they're not going to appear on the list because those UNEs aren't overdue. It's going to apply their grace period. They can get them done at any point during those. The most likely thing is they had the sample done together, but they've gone to different parts of the lab. We've got the full blood count in now. The UNEs may be in an hour or two. Those aren't the people that appear on this list. These are the people who have some results in, but the results that you don't have are now overdue. So if we look at this patient, we can see they have a full blood count, but we're missing liver function, and we're not missing liver function, we're missing UNEs. But the due date was the 1st of November, and they have a 12-week normal interval, which would give them a 2-week tolerance period. That would be here. So those UNEs are now overdue. They're not a complete non-attender because we've got some tests, and those tests have just come in, really. So it could well be that the UNEs are also on the way. So although they're overdue now, we may be getting them because we have only just got the full blood count. So it's worth waiting a little bit longer for those. They might just be in the pipeline. So for this particular patient, I'm not going to do anything. I'm just going to leave them. They will stay on the list. I'll check it again tomorrow. Check it again the next day, possibly. If the UNEs still aren't in, then what we might do is follow them up. But it looks as though they might be on the way. So we'll just move to the next patient here. And she's just got an ALT. And again, it was due on the 8th. She's on a 4-week appointment, so she would should have a 10-day maintenance period. So there we go. That's 7, 8, 9, 10. So the rest of those tests are now overdue. But if I look down in the history, I'll see actually she was tested just a week before that and had a full set of results, but the ALT was high. And I've got a note in here saying that we decided we would retest the ALT in a week. That's what we've done, and it's normal. So I probably don't need to repeat all the other things. It was the ALT that we're concerned about. That's come in, that's fine. So what we're fine to do probably is just move her onto a next appointment, and we'll get everything else tested in another 4 weeks' time. When I try and close the visit, Dawn is going to tell me that I'm missing these, and it will actually be 5 weeks for the full blood count and UNE. It'll actually be 9 weeks for a urine dipstick because we haven't done that. If I'm happy with that, these certainly are around about the normal interval, so we'll just say OK to that and proceed. And there's Erica dealt with now. She's all set for another set of tests at the beginning of December. So that just leaves Eric, and let's see what's going on with Eric. Eric has UNEs, but they're from the 4th. They're actually due on the 11th. He's only on a 2-week interval, which would give a grace period of a week. So these tests are now overdue, but it doesn't look, the test results that we have are from a week before it was due. So it doesn't look like we've just it doesn't look as though the liver function and full blood count are still in the lab and just coming through. It doesn't look like he's had them done. In fact, these UNEs might not have been the test that we asked for. They might have been requested by the GP or another department, and Eric has since forgotten to have his blood tested for his rheumatology monitoring. So really, for our intents and purposes, Eric is a DNA. These results are useful, you know, as reference, but they're not the full set of things that we need, and he's now overdue for them. But of course I can't DNA him because he has some results. So what I will do is close this visit, and I'll move him on to when I want to see him again, which is going to be, let's see, he's on a 2-week interval, let's say a week's time from now. I'll close that. I'll be warned about the missing results. The reason I'm closing incomplete set of results in order to follow up as a non-attender. And there, Dawn's moved him on to a week's time, and that's when we're expecting the results. The trouble is, Eric doesn't know that because we haven't sent him a reminder, and we don't know that he's actually failed to attend once for this set of results. So what I want to do, I do want to DNA Eric in the normal way. So I press the DNA button, and what it tells me is I can't DNA a date in the future. He can't have missed a date in the future. So what I'm going to have to do is cheat here and pull that back to today, press the DNA button. Now it's going to let me move it on to where I want it to be, but we've actually incremented his DNA count now. And when I press schedule, it's going to generate his SMS reminder. So hopefully that will be the prompt he needs, and we'll get the results in. Montague, of course, is still on my list. I'm waiting for the UNEs, but the other 2 we've dealt with. So that's 3 different scenarios with patients who've got missed tests. One like Montague, where it looks as though they are just on the way in. Somebody else who we just wanted to repeat one blood group. So we didn't need the others. We'd got the result we wanted, and we can move them on again to an appropriate date in the future. And somebody like the last patient, where really they were a non-attender. They just had an early set of results which weren't everything we needed, and they don't appear to have had their blood tested or remembered to have their blood tested for us. So what we did was close that visit and then treat them as non-attender. So that's how we deal with patients who have some, but not all, test results missing.